Welcome back to Media 7. We're discussing the role and the quality of health reporting with Ray Lamb, Dr Lillian Ng and Wayne Brown. There won't be many news consumers who haven't heard of Herceptin and the debate over its funding. Less well known is the way the drug has been marketed. Last year, The Guardian newspaper revealed that Herceptin's owner, Roche, had secretly funded a fake advocacy group, Cancer United, to pressure governments into funding its new drug. Could that happen here? Well, Wayne, I suppose the question is, has it happened here?
Following the money is a really important thing that unfortunately the health reporters don't often do. One of the first things that drug companies do is fund photogenic user groups, and people just accept that. They don't say, well, who's funding? Where's the money? I mean, the money's really an important issue. If there's shortage of money, all those things about poor performance will trip up downstream. At the emotional level, the reporting of...
But emotion makes good TV, Wayne.
I know, but I think at the emotional level, health reporters are very good. That's always done as a crime-loss victim. But we don't report it as a business. And yet the biggest business in Auckland is the District Health Board. There is a lot of money washing around in this. I'd like to see Fran O'Sullivan sometimes go along and do something like that, a business type analysis.
Well, if you treat the New Zealand health system, the public health system as a business, that's a $12 billion business.
Well, it is. And I mean, ADHB was $1.4 billion a year, and my task was to, by improving productivity, get the loss from $100 million down, and it was looking like it being at $10 million this last year. Now, that's like landing a jumbo jet onto an aircraft carrier, getting it dead right. If you, for instance, had your room done up and you had a budget of $1,400 and it cost you $1,410, you'd think, wow, I got it right. And so, but we, instead of saying $1.4 billion, it was $1.4001 billion, you think, okay, oh, it's terrible. But in fact, it's a really good effort. So,
and of course, you're never going to have enough money to do all the things that you want to do or that people want you to do. I wonder what you other two think.
Well, the whole thing about health decisions is that all health is about prioritisation. It's all about rationalisation. It's all about scarce resources and how best to get the most bang for your buck. And I think you're right, you need to follow the money, but by the same token, that personal narrative is also very strong, and you shouldn't underestimate that, because everybody knows somebody who's had breast cancer. Right. Everybody knows somebody who's been affected by even a rare disease. So, that personal narrative is a very integral part of storytelling, which you cannot dismiss at all.
It's interesting because if you consider what is probably one of the most common stories you see in health, which is very much tied up in money and resourcing, and that's waiting list stories. And the classic example you see is some poor person hasn't got their surgery, they're stuck on a waiting list and they can't get it, and hardly ever takes it a step further and actually examines why that is and what the issues are around the funding of the waiting list.
It sometimes seems that elective surgery waiting lists are the only valid measure of the health system. If you were reading the papers, you would form that impression.
Well, I mean, they are an important measure. But, if you look at a few years ago, there was a really good example. There was some people might remember there was a pensioner in the South Island, and he was all over the front pages of the papers. Ripley's, believe it or not, picked up the story overseas and came up and did it. This was a gentleman whose fingers were turning gangrenous, and there was a picture of him. He was on television, on the papers, with his black fingers, some of which he was reported to have had to cut off because they died.
I remember it. It was horrifying. It was big news.
It was presented as a classic waiting list story that this chap had been waiting for an operation, couldn't get it because of funding issues. Now, one reporter decided to go and visit him, got his permission to talk to his doctors, and then in a Saturday paper, in a story that was buried compared to the earlier ones, reported, in fact, the true facts of that case. And this was, there were actually clinical reasons why he hadn't got his surgery. He had a heart condition and they couldn't operate. He'd actually done quite well out of the health system. He'd had something like 19 admissions to hospital over the previous year.
This is very like the Roe Williams story in the 1990s, which was actually a much bigger story. It was all over. I think Holmes was all over it. Politicians lined up behind it. And the fact was that this unfortunate elderly Northland man didn't meet the criteria for dialysis. Among other things, he had mild dementia. I mean, were you actually the chairman?
I was the chair and was interviewed by Laurelie Mason at the time, who was pretty good about it. And it was and I backed our doctors who had chosen, for medical reasons, not to do this. And It's very easy for people to jump on the bandwagon. We have an adversarial government, and there's always someone on the other side, whoever it is on the other side, that's got an easy answer.
Stories.
And there's always someone who pops up to be the family representative, whether they're part of the family or not.
But that's also important because that is affecting for people. And when people come to talk about their personal illness, I mean, it affects not just them, but a huge number of people in their community. So, I mean, we're talking about young people that do get cancer. I mean, it affects them for their lives, and then also there's the decisions for some of them. A young woman, 21 years old, who has had to raise $100,000 for her own Herceptin treatment. I mean, there is a huge shift towards evidence-based medicine, and I think that is where clinicians would like to see their money most spent. Good evidence which informs good policy, and not just this react. It's election year. We've just got, we're doing this because of this. I think it's got to be well thought out. There has to be a strategy and good forward planning and a real vision for health. And I think that's where there are some big holes.
But the difficulty is in presenting that sort of thing as a story. Reporters are under pressure from their news editors to make it a human story, to have a patient story in there. And I think as a result, you get this focus on individual stories, what's happening to that patient, the response to that, and you don't get the stories that you need about the bigger issues.
Which was the case with, and I'm not going to ask you to comment on that because it was on your network, the 60 Minutes story on Herceptin, which I thought was an extraordinarily manipulative piece of television, was duly wrapped by the BSA. Is there a right way to tell that story? Because that wasn't it.
The right way would have been to provide much more balance on the other side. And, to counter that, and I'm not sure whether it was 60 Minutes, I think it might have been, more recently I saw a better example where they did a story about waiting lists. They looked at New Zealand hospitals at the winter rush and how emergency departments are always full, people are in corridors. And what they did was they went offshore and looked for some solutions. And they did a story about a hospital in Australia that was trying a new systems approach, which was a much better way of looking at a story. And I think that kind of thing could have been applied to the Herceptin story.
But by the same token, I think, I have 2 minutes to tell a story, and I think there's a lot of power in the story that you can, and the impact that you can achieve with a story which is 2 minutes long. But having said that, you can explore some of those issues. And the very most recent story that I did was about emergency surgery at Hutt Hospital, plastic surgery, and we went to that surgeon who had published an article in the New Zealand Medical Journal, and that was not picked up by any other media. I believe that we were the sole outlet that actually, the network that reported that, and we got some answers about that. The whole issue was the lack of access to operating theatres, and we were able to ask some of those deeper questions and what you can achieve if you take the complexity and try and break it down and make it in a way that you can actually create a dialogue and communicate with the audience.
It can be very hard to do that, though, with stories that involve statistics.
Well, particularly.
It's hard to get the money discussions across because it's non-emotional. It's hard to get a debate about end-of-life care, where most of the money is spent. And I know that at Auckland District Health Board last year we advertised widely that we were going to have a whole board meeting about end-of-life care, palliative care, death, whether it's wise or unwise to start replacing hips in people in their late 90s who struggle to handle the operation for a number of other reasons. And the news mostly mocked it, actually. The only coverage in the Herald was in Sideswipe, saying what sort of hospital would talk about death. The people who came to it clapped the clinicians who came along and spoke about the correct palliative terms. I mean, a lot of people die in hospitals. If you're lucky, you will die in hospitals when you're in your late 90s, and you will want good end-of-life care. You won't really want a new leg then. You'll probably want all the cool drugs and the opportunity to say farewell to your family in a dignified manner, and that's an important thing. It's a very hard thing to debate.
That's interesting because it's a story about death that happens to everyone. That's surely a story that everyone could relate to.
Well, a doctor had put in the things there, death is a natural part of the human experience. That was the bit that was mocked in Sideswipe.